So, welcome back to Herbal Basics. And in this presentation, we'll be looking at part 2 of the advantages of chemical complexity, as you might find in a medicinal plant. So in part 1, we looked at the concept of synergy. And it's a term that's thrown around, and you'll see examples of that in this presentation. But it's, as you saw from part 1, synergy has quite a strict definition. It's rather one-dimensional. It's about two components affecting one target, and it's plotted on an axis. So it's a very one-dimensional sort of narrow concept. And it's quite often when we hear people talk about the synergy of herbs and what have you, really they're talking about other phenomena, backed up by synergy, no doubt, but much broader. And that's what I'll be discussing in this part 2. So we're going to start off by looking at the entourage effect. And then this really central concept of network pharmacology, backed up by the proposition that herbal extracts are intelligent mixtures. And I'll illustrate that this is not just theoretical by a remarkable clinical example of the use of the herb Artemisia annua. So what is the entourage effect? It's a concept that pertains to the synergistic, and given what I've said in my intro, I've put that in inverted commas, the synergistic interaction of various compounds present in medicinal plants, particularly in the context of medical cannabis. So the people involved in medical cannabis, let's face it, they're really good at spin. And this is a beautiful word. They have come up with, I think, a word that we should be trumpeting and applying across the board, not just in the context of medicinal cannabis. Entourage, I love it. And what it does is it suggests that the combined action of multiple components like the cannabinoids, CBD and THC and others, the terpenes, and other phytochemicals in medicinal cannabis produce a more profound therapeutic effect when they're all together than the isolated action of a single compound. Now, this is way more than just synergy, as I'll illustrate. And it implies that the therapeutic potential of a medicinal plant is not solely attributable to a single active compound, as I discussed in part 1, but rather due to the intricate interplay between these multiple constituents. And hence the entourage effect is another way of describing this concept of network pharmacology. It's much more than just synergy, although it can be backed up by synergy as we defined in part 1. So what's network pharmacology? It's an interdisciplinary field that combines principles from pharmacology, systems biology, and network science to study the complex interactions between multiple components in biological systems and their impact on human health. And it has been particularly taken up in the context of medicinal plants, and especially by Chinese researchers who are doing wonderful work in this field, looking not just at individual herbs, but herbal combinations as found in traditional Chinese formulations and the network pharmacology that might underpin those. So it aims to understand how the various bioactive components within a plant, or indeed a mixture of plants, interact with each other, and especially with the human body's biochemical networks to produce a given therapeutic effect, and many effects are likely. And it typically integrates data from the various disciplines that are known as the omics, so genomics, transcriptomics, proteomics, and metabolomics. A few tongue twisters to get us started. Through network analysis, researchers can identify key nodes or central elements within biological networks that play crucial roles in mediating the effects of the herb under study, such as specific proteins, genes, or pathways that are pivotal to the plant's therapeutic action. Now, combined with this was a very interesting proposition put forward by Jörg Gertsch more than a decade ago, and a discussion in the journal Planta Medica of herbal extracts as intelligent mixtures. Now, I've had the fortune of collaborating with Jörg Gertsch in the various aspects of echinacea research, and he is a really top scientist. And he's now working in the field of phytocannabinoids, because the discovery he made was that the alkylamides in echinacea are phytocannabinoids. So he proposed that herbal extracts might be complex mixtures with an inherent intelligence about them from a pharmacological perspective. In other words, intelligent mixtures. Particularly when it relates to the secondary plant metabolites, the various active components and marker compounds that we use in herbal extracts, because these have been shaped by evolutionary pressures which lead to the better enhanced survival of that plant from infection, from predators, from environmental challenges, from drought, whatever. It's created an essential intelligence in that mixture of those secondary plant metabolites. And the network pharmacology concept is also highly relevant here. And because, in other words, this intelligent inherently supports network pharmacology effects. And what I'm saying here is that because it's an intelligent mixture, it's way more likely to demonstrate a network pharmacology effect in the human body rather than just a random mixture of chemicals that we might throw together ourselves. Another way of putting it is that we're using a therapeutic agent that was once alive, once a living organism, and built into that and built into its chemistry is a particular affinity for having effects on other living organisms. So the possibility is that if we're using a plant extract or a herbal extract, that if we take a signaling network in the human body, that different proteins within the same signaling network are only weakly targeted, because most of the plant secondary metabolites, unless it's a poisonous plant, are inherently pharmacologically mild. So there's only weak targeting of individual protein targets within some sort of pharmacological network. However, because it's occurring over the network, this is sufficient to either shut down or activate a given process in the body via this powerful network pharmacology effect. And it explains how something that comprises phytochemicals that are pharmacologically mild in their activity can exert a powerful therapeutic effect. So here's a one-dimensional, simple example of network pharmacology. So say your biochemical target is you want to reduce the levels of the substance T in the human body and thereby alleviate some symptom or disease or whatever. So in modern pharmacology, they'll come up with a drug called X that will stop the conversion of S to T, and you achieve the effect. But to do that, and to do it in a significant way, it might need to be quite a powerful drug, and it might therefore have side effects. And one of the side effects that you might get is if you stop the conversion of S to T, you're going to end up with too much S. So you can think, oh, well, we don't want too much S. We can move down the network and we'll target P to Q, and that'll eventually lead to less T and a little bit less S rather than too much S. But again, you're risking possible imbalances in the body's physiology. So in network pharmacology, say, for example, every step in that biochemical network is targeted. Each effect is mild, but in some, it leads to a powerful therapeutic effect, and T is dropped down to the desired levels. And because you haven't highly perturbed the levels of P, Q, R, and S, you haven't caused any side effects. But network pharmacology really looks like this. This is from one of those wonderful Chinese studies I was talking about. And this is for actually a herbal combination rather than just an individual herb. And you see the spheres of different colors, purple, green, they are the nodes. Remember I said in network pharmacology, you identify the nodes. So we don't necessarily get into the complex detail of this paper. I've given you the reference if you want to go and read it, if you're interested in it. I hope you are. But just to illustrate what a network pharmacology for a herb extract or a herbal combination looks like, with the identification of specific nodes related to specific therapeutic targets. So one of the other concepts that links in with network pharmacology is this concept of polypharmacology. And that's getting more and more recognized in mainstream drug research as well. So polypharmacology describes the activity of compounds that are multiple, that a particular compound has multiple targets. And when you're dealing with pharmacologically mild substances, as you find in a plant like curcumin, we find that it has a huge number of therapeutic targets. And this large number of therapeutic targets means that a single plant chemical can act like via network pharmacology just on its own if you're using something like curcumin. So again, it's being recognized in mainstream research, and the current research focuses on two aspects. That unintended polypharmacy can, of course, lead to side effects. So a particular drug might have a strong action here, but it also has a strong action over here that you don't want, and that translates to a side effect. But on the positive side, and this is where it relates to intelligent mixtures and network pharmacology and the inherent polypharmacology that is there in many individual plant phytochemicals, polypharmacology across several disease-relevant targets can improve therapeutic efficacy. That's network pharmacology, isn't it? Prevent drug resistance or reduce adverse effects, all as described in the simple example I gave you earlier. So let's drill down a little bit more on this excellent and insightful concept, which is that herbal extracts are intelligent mixtures. And this concept refers to the inherent complexity of the various bioactive compounds that are naturally present in the plant. And this complexity, as I mentioned, is deeply rooted in the plant's evolutionary history and its interaction with the environment along the way. And specifically over millennia, plants have evolved in response to various environmental and ecological pressures. And their synthesis of diverse bioactive compounds, pretty well always as secondary metabolites, we call them, represents an adaptive strategy to ensure survival. So the pharmacological effects of plants in humans and animals as well are hence a consequence of the plant's adaptation to its surroundings. And it's particularly underpinned, I put driven, but perhaps underpinned, a better word, by the common ancestry between enzymes or proteins that are found in plants and similar ones that are found in humans. So case in point, you look up the top right, you see enzymes CAT for catalase, SOD for superoxide dismutase. This is talking about plants. Plants have SOD, plants have catalase. So things that are in plants that might interact with SOD or catalase might also interact or induce SOD and catalase in humans. So that's what I'm going to talk about next. Why specifically should the phytochemicals, particularly these secondary metabolites, have pharmacological activity in humans? Well, there's a researcher, Michael Baker, and he's shown that enzymes in animals can share a common ancestry with enzymes or proteins in plants. And this evolutionary kinship, combined with structural similarities between the plant substrate and the human substrate for these enzymes, means that the product of a plant enzyme might interact with a human enzyme, even though that human enzyme now has quite a different function in the human being than it had in the plant. So a plant might make, for example, glycyrrhizin, a licorice plant, and glycyrrhizin then interacts with some of the steroid hormone enzymes in the human body, because the enzymes in the human body related to steroid function resemble the enzymes that made the glycyrrhizin. So naturally, if the enzyme has made the glycyrrhizin, there's going to be a potential interact of glycyrrhizin with parallel or similar enzymes in the human body. So this leads to modulation of enzyme function in the human, and hence a pharmacological effect. There's also an Australian researcher called Rod Quinn at Griffith University in Brisbane, and he has done similar work and published in this area as well. And supporting Baker's hypotheses, looking at more recent studies, you see this study, researchers have shown that certain plant proteins resemble human signaling proteins of the immune system and combine to their receptors. And I've always used this example in trying to explain how herbs work on the immune system. Because, for example, there's a concern that herbs might drive autoimmune disease, but autoimmune disease is in the adaptive part of the immune response. And plants don't have an adaptive immune response. They only have an innate one. And that's why I believe that many of the phytochemicals found in plants that have an immune action specifically target the innate immune system in the human, and therefore are quite safe in autoimmune disease, for example. And as already mentioned in the discussion of Baker's work, there's also the likelihood that substrates of plant enzymes will interact with similar structured human enzymes. So, where's the proof of the pudding? Is the whole herb better than an isolated phytochemical? Well, you can't have a disease that is more challenging than malaria. So let's look at this wonderful Chinese plant, sweet wormwood, or Changhao as it's called, or Artemisia annua as it's known botanically. And for the first time in phytochemistry, the Nobel Prize for Medicine was shared by Tu Youyou for her contribution to the discovery of artemisinin for malaria. So it's never before happened that someone who has isolated and worked on a plant compound has won a Nobel Prize in medicine until her great contribution. If you look at Artemisia annua, it dates back to about 168 years before the current era and was used for periodic fevers that may well have been malaria, and that's what attracted the interest in it. Artemisinin can be difficult to extract and process, and even the traditional methods of preparation probably optimized artemisinin extract. So artemisinin as a pure chemical is not very bioavailable, and this has led to the development of artemisinin derivatives that have been used mainly now in drug therapy for acute malaria. But here's a really interesting clinical study that was published a few years ago. And the question is, does using pure artemisinin miss a significant advantage? So it was a case series of 18 patients who hadn't responded to artemisinin combination drug therapy, pure artemisinin with other antimalarial drugs called ACT, nor intravenous artesunate, which is an artemisinin derivative that's more active and bioavailable. So it failed. These patients had acute malaria and the treatment, falciparum malaria, and the treatment failed. So in the study, they instead gave just 1 gram a day of Artemisia annua leaf containing 55 milligrams of artemisinin, which is quite a low dose, for 5 days. And the extraordinary thing was that all patients who have been refractory to drug therapy with high doses of purified artemisinin or its derivatives, all patients, including children, fully recovered from using the whole herb. So in conclusion, we can suggest that the body is not a one-note melody, but a symphony of many interactive components functioning synergistically in this quote from Sharma, but a better word would be functioning in an entourage effect manner. The active ingredient model doesn't stem from a strength of scientific method, as often supposed, but rather a weakness from the inability of the reductionist to deal with complex systems and issues such as the entourage effect and network pharmacology.